In the name of God, most gracious, most merciful, we would like to welcome the speakers to this press conference of the Medical Task Force, Dr. Muhammad Mubarak, Director General of School Affairs, Ministry of Education, and Dr. Mariam Al-Hajari, Assistant Undersecretary for Public Health in the Ministry of Health, Lieutenant Colonel Dr. Manaf Al-Qahtani, Infectious Disease Consultant at the BDF Hospital, and Dr. Jamila Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. And we would like to note that this press conference is going live on TV and on the YouTube channel of the Ministry of Health in 5 different languages. And we also have the journalists and reporters joining us remotely. Now, we begin with Dr. Muhammad Mubarak, Director General of School Affairs at the Ministry of Education. In the name of God, most gracious, most merciful, peace be upon you. Well, welcome everyone, and I'm pleased to be with you in this press conference in which we're going to have 4 main pillars regarding the current situation. The first pillar is related to the current semester and term in the in education, and the second pillar will be about the updates regarding the booster dose, and the third pillar will be about the updates on the booster dose, and the fourth pillar will be about the vaccination for kids aged 3 to 11. As for the instructions regarding the new semester, as you know, the education system is going to follow the traffic light system. So if it is in the red level, it will be electronically online. But if the level is green, yellow, or orange, education will be either attend physically or online, and the option will be up to parents to decide on which type of system they want to enroll in. This is for the education according to the traffic light system. Well, in terms of the percentage of attendance, well, if we're, God forbids, in red, then education will be online fully. As for the rest of the colors, green, yellow, and orange, the attendance will be for green will be 100% for the capacity of school, taking into consideration the social distancing. For the level yellow, it will be maximum 50%, taking into consideration the social distancing, and for the orange will be maximum 30%. Well, in relation to the staff and cadres, the Ministry of Education and its associated institutes, it will be for according to the needs of the schools, for the government schools and all the directorates and the Ministry of Education. As for the private sector and schools, it will be up to the schools to decide on the number of staff and students. So, school education in public school will be, the capacity will be 100% for staff if needed, and according to the need of each school. And we also would like to note that the Ministry of Education has issued the guidelines for all the instructions and guidelines, and it will be available on the website of the Ministry of Education, and all schools and institutes can download this guideline, and also available for parents and students so they can get acquainted to the guidelines to be followed throughout the semester and all related instructions. And to conclude, I'd like to congratulate everyone on the beginning of the new academic term and reiterate the determination to continue all the achievements at the level of the Kingdom of Bahrain in terms of reducing the active cases, and we confirm that everyone should strictly follow all the precautionary measures and guidelines in order to protect the health and well-being of all academic staff and students, and we wish everyone all the best. Now I'll leave the floor to my colleague, Dr. Mariam Al-Hajri, Assistant Undersecretary for Public Health. Thank you very much. In the name of God, most gracious, most merciful, may God's peace and mercy be upon the Prophet. Good afternoon, everyone. Welcome to this press conference in which I'm going to update you on the most recent updates regarding the vaccination campaign. First, we announced that according to the assessment of the average of the new active cases out of the current PCR test, it has been decided that starting from Friday, 3rd of September 2021, we're going to move to the green level according to the traffic light system, and we confirm that everyone should follow all the precautionary measures which are under the green level, especially the ones related to starting the academic term in order to provide a safe return for our students and for the academic staff. And I seize this opportunity to congratulate everyone on this academic term, and we wish you all the best. And we also point out that with reaching 80% of vaccination for those aged 40 years and above, we would like to thank everyone for their awareness and responsibility in terms of themselves and their country in order to protect what has been achieved of progress in order to combat the pandemic and to prove the efficiency of the booster doses to protect the society and mitigate the spread of the virus. We call upon everyone, those who are eligible to take the booster dose, to please take the initiative and take the booster dose. And everyone can register for the booster dose through Be Aware app or the website of the Ministry of Health. And to conclude, we confirm that with your collaboration, all, we're going to continue to combat the virus and protect ourselves. And we pray God to protect our kingdom, leadership, and people, and to have the well-being for everyone. Now, I'll leave the floor to Lieutenant Colonel Dr. Manath Al-Qahtani. Please, the floor is yours. Thank you very much, Dr. Mariam Al-Hajri. In the name of God, most gracious, most merciful. Good afternoon, everyone. Today, I'm going to talk about the booster dose, which we started months ago. And before I start talking about this, medically speaking, it's important to explain the difference between the additional dose and the booster dose. In terms of clinical studies for COVID, you have two doses. These two doses, they have the first and the second. The second is called the additional dose. Why this is there? Because according to the studies conducted at the first and second phases and confirmed during the third phases that the human needs 2 doses in order to create antibodies, and depending on the bodies of people, it varies. So we adopted 2 doses. So whoever takes, a booster dose means, they don't have the sufficient antibodies. So the booster dose is different. It's given for those who have already created antibodies, but after a period of a time, those antibodies were reduced and became weak. And so the efficiency of the booster dose is to enhance immunity. It means to increase the antibodies and activate the human body to create more antibodies in order to reduce the complications of the virus. So as we have seen, after the pandemic and with the increase of the active cases in May and June, we had great benefit and a pre-step taken by the Kingdom of Bahrain based on data and studies that proved the efficiency of the booster dose. And this proves that our decisions in the Kingdom of Bahrain, the medical ones in terms of the coronavirus, are always based on 2 things: the assessment of the risks and the medical situation, and the second thing, based on data and studies conducted by a Bahraini team which are specialized in these studies, and accordingly we have the decisions and recommendations. And we are proud that many of the publications are from Bahrain in terms of the experience of Bahrain against the virus COVID-19. And we have a very important scientific research in collaboration with a great university, Columbia University. We published recently that were published in one of the prominent research square. And so just in short, a group from Bahrain and Columbia University analyzed all the data for more than 1 million persons who took the vaccine, and to assess 4 different vaccines which were studied and reviewed and proved that these vaccines, with the witness of this university, that those vaccines were efficient in reducing the spread of the virus and their complications. So I here come to a very important point. Those people specialized in the epidemiology, we always have a question: what is the benefit of the vaccine? The vaccine is not only to reduce the virus. The main objective was to reduce the complications of the virus and the disease itself. And therefore, all the measures are based on the reducing the death cases, in reducing the admission of patients into hospital. And I think Bahrain, with having 4 types of vaccines, and people might wonder why having 4 vaccines, we have provided service and favor to the international community, because we compared 4 different vaccines for more than 1 million people. And this would contribute to drawing the future plans for the international community. And Bahrain has set a fingerprint into this context, and we as Bahrainis should be proud of. And therefore, I think, as usual, we always update you on these studies. We also have certain international indications that reduced the complications, because we have found that 79% of those death cases in June 2021 are from those who did not take the vaccine. And it was at the time when we had the Delta variant. And this, again, proves the efficiency of the vaccine because it reduced the death cases and reduced the admission of patients into hospitals. Therefore, this is the ultimate objective of the vaccine, and I call upon everyone to take the vaccines because Bahrain, we have proved to be collaborative citizens and residents, and we have an option for people to take the vaccine, but people decided to follow this, take the right information from the right people. And for those who have not yet registered for the booster dose, I think it's time to reconsider this in order to protect yourself, your family, and your country. So, to conclude, we shall remind ourselves it's important to follow all the precautionary measures at all levels according to the traffic light system. And it's important to take the vaccine, to follow the recommendations of the medical task force, and we've seen the fruits now. And hopefully all our efforts are going to support mitigating the spread of the virus, not only locally, but also internationally. Now I'll leave the floor to my colleague, Dr. Jamil Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. Please proceed. Thank you very much, Dr. Manaf Al-Qahtani. In the name of God, most gracious, most merciful, welcome to this press conference. Now I'm going to update you on the fourth pillar. We have many points. First, I confirm that the reduction of the virus percentage and the reduction of the critical cases or those receiving the treatment and the reduction of the death rate does not mean that we have already finished the virus. It is still there. So we have to warn ourselves of the false allegation. So we have to still follow the same precautionary measures and take the vaccines and the booster dose, which proved their efficiency, and in reducing the active cases, and also commitment and protection. This is our slogan for the past months. So the protection comes by taking the vaccines and the booster doses, and at the same time to follow all the precautionary measures. And we reiterate that hopefully this is going to take us into the real safe end. And the second point, thank God, the Kingdom of Bahrain started to provide vaccination for those aging 3 to 11 years old who have lack of immunity or chronic diseases to take the Sinopharm. And thank God we have seen the collaboration by parents. And we also have a great percentage from those aged 12 to 17 years old who have been given the option to take the Sinopharm and Pfizer BioNTech. So we call upon all parents to register their kids according to their ages and according to the recommendations of the National Medical Task Force in order to protect themselves. Especially at this level, we are about to go back to schools, so it's important to take these vaccines. And hopefully it's going to provide the protection for them and to continue their term in order to not to have the disease and not to transmit or transfer. And in this context, it's important to follow all the guidelines that are related to our kids returning to school and for the academic staff. And to conclude, it's important to keep in mind the social distancing and which all citizens and residents have proved to be collaborative, and eventually we're going to achieve our ultimate target. Thank you very much, the speakers, for your briefs. Now we move to taking the questions from the journalists who are following us remotely. Question from Tamam Busafi, Al-Ayyam newspaper, to Dr. Muhammad Mubarak. Now, returning to schools and a large number of students going back to the traditional schools classes, what about the efficiency of the precautionary measures and social distancing and the wearing masks? What will happen and what steps will be taken in case active cases were discovered? This is a very important question, especially in line with the data, with the number of students who have already wished to return to school. Now we have 79,000 students who registered to return to the physical attendance in classes. Well, we have clear guidelines in the guidelines issued by the Minister of Education, and we also have teams in schools and institutes who are working continuously to implement all these guidelines in order to ensure the safety and health of those, whether students or staff. We have many steps that were taken and will be taken upon their return. As you know, starting from today, the staff already returned to schools, and a number of steps will be taken, including starting from the first hour of the students returning to schools, whether coming from bus or their parents' cars, up to entering the class, up to going back to the break, and going back home. We have clear steps to deal with all these. And also the disinfection process will be carried out throughout the day, and all of them will be obligated to wear masks. So we have special teams in schools who divided and distributed the classes and tables that ensured the social distancing. And in accordance with the traffic light systems, we're going to conduct random tests in schools, which would also provide protection. We also have partnership. The schools have responsibility in implementing all the precautionary measures available on the Ministry of Education guidelines, and at the same time, parents and school and students shall also be responsible to follow the guidelines in terms of wearing masks, and also while outside school, they should also keep in mind the social distancing, because they might come back to school and spread the virus. So it's important for everyone in order to end the semester safely and achieve the ultimate objective, with whether it's online or physically, and will be carried out by professional staff in schools. Thank you very much. Question to Dr. Mariam Al-Hajari from Ahmed Al-Khalid, Al-Watan newspaper. The strategy for those returning to Bahrain has been changed. Before it was upon the arrival and after 10 days. So now it has increased to 3 tests. So what is the reason behind the increase, and also the increase in the cost? Thank you. I thank Ahmed Al-Khalid from Al-Watan newspaper for this question. Well, the PCR test adopted recently is in order to protect the health and safety of everyone, with the return of many people returning from abroad, and also to check to detect the active cases before they mingle with everyone. This decision as an action, as a precautionary action. As you know, before we had test upon the arrival and after 5 days and after 10 days, and the cost was 36 dinars. After the reduction in certain periods according to the updates, it went like only upon arrival and after 10 days. And as we said, in order to protect the health of everyone, we have got back the test on the 5th day. So the cost did not change technically. It's still the same. So we do this test upon the arrival on the 5th day and on the 10th day. So it became like the first period. As I said, this comes in order to protect the health and safety of everyone and in order to protect the achievements in terms of reducing the active cases in the Kingdom of Bahrain. Thank you. Question from Muhammad al-Nahas, Al-Usra online newspaper, to Dr. Manaf al-Qahtani. Doctor, why not imposing vaccination on all students and staff before entering schools in order to protect the health and safety of everyone and to mitigate the spread of the virus? Thank you, Mr. Muhammad. Well, today Bahrain is among the top countries, the third countries in terms of taking the vaccines. We have reached 91% of the population who are eligible to take the vaccine, at least who took like one dose. So we have taken the process of convincing people, and people have proven to be aware and that our policy had proven to be efficient because they were following the recommendations of their task force. Secondly, we have given options for the vaccines and it's free of charge, and we have conducted a clinical study. So my message to all parents or like staff or teachers, if you did not take the vaccine for whatever reason, please consider it now. Take it seriously now. We've passed 18 months so far. We have 10 months, and thank God we have got the fruits of the vaccines and we have proven its efficiency and safety. None of the houses in Bahrain don't have vaccinated. So we are left now for those people aged 3 to 11 years old with chronic diseases. So we don't want them to have the complications. So those who claim that they are not in danger, it's not true. Those with chronic diseases, we have to focus on them and we have to protect them. So me as a parent, I shall not hear the false allegations. We have seen the experience in the Kingdom of Bahrain, and those kids who took the vaccines still have good results. So I go to the teacher. The worst thing is, like, God forbids, by any chance you transfer the virus to one of the students. And this student could be like with chronic disease and they might have the complications, and then the regret won't help. So the decision is now. Just take the decision. And this is my personal message to all parents and teachers. Please take the initiative in order to protect our kids. Question from Bana to Dr. Jamil Salman. With the decrease in the number of the active cases and the decrease in the critical cases, is it expected that that these cases might come up soon with the return to the green level? Thank you for the question. It's an important question. Everyone is asking this. Are we going back to the increase in the active cases? Well, after dealing with this pandemic for like more than a year and a half, we have real scientific proofs and facts. We've seen many countries what we call waves. So they have like first wave that attacks those who have weak immunity or did not take the vaccine. So any wave could attack those who have like the lack immunity or did not take the vaccine, and might get reduced until it has like variants. And COVID-19 proved that it has different variants over time. So the main facts, whether we have the reduction as we are moving now into the green level, it's important to focus on the main facts that proved its success, even following this scientific research to combat this virus. So we mentioned it's important not to have the false allegation. And this is what we want to focus on. But the things that we need to focus, and they are necessary, this level, at the green level, to continue taking the vaccines, which all the studies proved its efficiency, whether in Bahrain or outside Bahrain, and also taking the booster dose because it helps into strengthening the immunity and the variants also. The main third point is, while moving to this green level, is to strictly follow the precautionary measures and guidelines, because we're going to reduce the transfer but not stop fully. It will reduce the complications, it will reduce the death cases. So in order to reach the ultimate goals, which is to go back to normal life, is to follow all the precautionary measures, social distancing, wearing face masks correctly, and disinfecting hands and surfaces. If we keep all of these into consideration in our normal life, in our normal activities, we're not going to see any increase in the active cases, hopefully. Thank you very much. Question from Mohammed Al-Nahas, Al-Usra Al-Arabiya online newspaper, to Dr. Muhammad Mubarak. What is the plan for the Ministry of Education for those with special difficulties, especially some of them have weak immunity? Thank you for the question. This is a very important one. Well, those with special needs and difficulties, as the rest of students, they have the right to access education and to go to school. And as the Minister of Education announced, schools will be fully ready to receive students with special needs. But let me just point out the importance of awareness and vaccines. As mentioned by Dr. Jamila, the vaccination is now open for those aged 3 to 11 years old. So it is an important opportunity to remind ourselves of taking the vaccines, because it would provide protection and necessary for those with the special needs, and it will motivate them to join schools and to receive the appropriate education for them. In addition, the guidelines issued by the Ministry of Education you will notice that it has a special section for students with special needs, and they will have special dealing in terms of rooms, playgrounds, and so in terms of the education, there are clear measures, and they are provided as training for staff. But still, there is responsibility upon parents in terms of encouraging themselves into taking the vaccines, encouraging their kids to take the vaccine. So it is a collaborative responsibility, and we're going to take the full consideration, and we call upon parents and students to follow them as well. And on top of them is education. I stick with you, Dr. Muhammad. Rashad Ibrahimi, will the duration of the day be changed, because students should not be allowed to stay for more than 2 hours? This is correct, but classrooms are not open. They are rooms that have the necessary of open, and I thank all the members of those attending with me, because they have contributed into building this. So they have the exchange of air by opening the windows and the doors, so it's not going to be risky. And as we know, the process of education, this is a right, so we need to provide the sufficient education, and they would need to stay in education in schools for a certain time. And the ultimate goal is to have the sufficient education as necessary, and to have will help them into moving into the second, whether they are graduating from schools or joining universities or at any level. Thank you very much. Now we conclude the question and answer section. Thank you very much to the speakers for your briefs and answering the questions, and also for the journalists for joining us remotely, and for you, ladies and gentlemen. Before concluding, kindly be reminded to follow all the precautionary measures and guidelines to mitigate the spread of COVID-19 and combat it. Thank you very much. So what happens what happened in the beginning?
Yeah, the mic.
Because I get distracted when I see people moving.
Yeah.
I need to